Welcome back to Learning Pathology with Dr. Bhavana Granthi. Now we'll see about glycosuria or glucose in urine. Urine having glucose is called as glycosuria. Causes being diabetes mellitus, the most important cause, followed by hypothyroidism, Cushing syndrome, and renal glycosuria, elementary glycosuria are the next important ones. The other being increased intracranial pressure and Fanconi syndrome. The test for glycosuria, the copper reduction test, filling test and Benedict test, enzymatic test, glucose oxidase reagent strip method and ozone test. So we mainly focus on Benedict's test because it is the most frequently asked experiment. When the reducing sugar is subjected to heat in the presence of an alkali, it gets converted to an enediol, which is a powerful reducing agent. This is the principle of Benedict's test. The cupric ions present in Benedict's reagent are then reduced to cuprous ions. These cuprous ions form copper oxide with the reaction mixture and precipitate out as brick red colored compound in the presence of sugars. We'll first see what are the components of Benedict's reagent. Sodium carbonate, sodium citrate, cupric sulfate, which are distilled to 100 ml of distilled water. Copper sulfate acts as a source of cuprous ions. Sodium carbonate provides the alkaline medium. Sodium citrate forms complexes with the cuprous ions. This is the Benedict's reagent. We have to take 5 ml of the reagent. It is a semi-quantitative method. So, the quantities are fixed. Reagent is 5 ml and the given urine sample is 8 drops at 0.5 ml. The reagent is heated, then we add the sugars or the urine sample in the sugars will be present and there is reduction of the copper oxide producing a orange to brick red compound. This color depends upon the amount of glucose present in the given urine sample. This is how we grade the glycosuria by Benedict's test. When there is no color change, that is, Benedict's reagent is blue color, so the color will be blue. When it is pale green, traces. When it is green, 1 plus, 0.5 to 1 gram per deciliter, 2 plus when it turns to yellow, orange when it is 1.5 to 2.5, it is 3 plus, finally brick red when it is 4 plus, the glucose or the reducing sugar is more than 2.5 gram per deciliter. In a tabulated form, negative, no change in color, traces when there is pale green, green 1 plus, yellow 2 plus, orange to red 3 plus, brick red 4 plus. What are the other reducing sugars which give you a positive test with Benedict's is the next frequently asked question. The answer will be fructose, lactose, galactose, xylose, pentose. Apart from glucose. Sucrose is a non-reducing sugar which will give you negative test. Next, the examiner will ask you, what are the reducing substances which give false positive test? Uric acid, creatinine, salicylic acid, homogenetic acid, ascorbic acid, morphine, paraldehyde and INH, a drug. These give false positive test. This is also again a frequently asked question. How do you differentiate renal versus elementary glycosuria? Renal glycosuria is excretion of glucose in urine in detectable amounts at normal blood glucose concentration in the absence of any renal tubular dysfunction. It occurs in renal familial glycosuria with mutations in the sodium glucose cotransporter 2 gene. Whereas elementary glycosuria, when there is high carbohydrate diet, it is rapidly absorbed in conditions where part of the stomach is surgically removed. So this excess of glucose absorbed and appears in urine producing elementary glycosuria. Thank you. So we have discussed about glycosuria. The next session will complete ketone bodies and blood in urine. Thank you.